Hi guys, today we're going to talk about another article that I was reviewing. This is a systematic review that was done to go over a lot of the predictors of clinical recovery from a concussion. This one was done by Grant Iverson and a few of his colleagues. Essentially, it's a fairly big article in terms of looking over a lot of different case studies. So I think they start out with a total of around 7,600 articles, and then it's kind of dwindled down to 100 articles that fit the standards for what they're looking for. But a lot of interesting details were kind of pulled from this article. So one of the things that you kind of are asked a lot with regards to, is this a severe injury? How long is it going to take me to get better? What are my outcomes looking like? So this article kind of looks at all of those research articles that were done recently and is trying to identify what the conclusions were on those set factors. So overall, one of the things to take home is that there's actually more conflicting information than you would actually hope there would be out there for a lot of those factors. One of the things that I know has been said a lot to some of my patients is that you need to lose consciousness for it to be a severe head injury. Well, what this article found is from a lot of the research out there, that's actually not true. So a lot of the some of those factors that you might have thought to be very factual with regards to you need amnesia, you need to lose consciousness, might not actually be the case. So that's kind of what this is finding here. But what are some of those factors that they're finding to be pretty accurate over most of the literature so far? Well, at least with the ones that they reviewed in here, some of the things that they found was when it comes to injuries, the symptoms or the severity of your symptoms in the acute or subacute phase can be a predictor in terms of how hard your concussion journey might be. Whereas someone in those those acute and subacute phases who have maybe don't really feel much of a concussion, feel pretty good, symptom-wise, everything's going well, and maybe have some things that come on later, those patients are a little bit more in a better situation. Same thing when we're talking about mental health in terms of do you have depression? Maybe you had long-standing migraines. Well, those two factors right there were found to be associated commonly with patients having a recovery time that actually is usually longer than a month. So that's kind of something that's been pretty consistent throughout a lot of the literature that this article was reviewing. And lastly, one of the things that we've kind of known for a while is children who are a little bit younger, kind of in the high school ages, and more predominantly in females, tend to have a harder time recovering from head injury than, let's say, someone in the university ages who's maybe a male. So some of those factors definitely do come into play and make it a little bit harder for those individuals to recover. So if you do want to have a look at this article, I will provide the list. But as you can see, they are quite intensive in terms of they go through every symptom that you might be having, and it'll list whether these articles that they read through found that to be either a confounding factor or if it impeded your recovery at all. So they go through that for several different symptoms that you might be experiencing. So it's quite kind of nice to read through, but the end result I think is always the same, is listen to your body, listen to your symptoms. Just because you're not you don't have these factors that say that you should have a severe concussion and you're still having problems with it, that's okay. Sometimes it's a little bit more confusing or a little bit more complicated than what it might be seen. So just do the best you can, get yourself a great healthcare team, and hopefully you'll start making that progression very soon.